Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been monitoring my blood sugar levels closely, and they generally stay between 100 and 190 milligrams per liter. The most recent reading I took was 137 milligrams per kilo. But, despite these seemingly okay numbers, you mentioned my hemoglobin A1C is a bit elevated. I'm concerned about needing more insulin.
Yes, your blood sugar levels are indeed within a relatively good range, but your hemoglobin A1C, which gives us a 3-month average, came back at 7.4%. This suggests that your overall glucose control could be improved. As a result, I've recommended an increase in your insulin dosage from 40 units to 45 units, and we might consider going up to 50 units after reassessing your levels.
I understand that. It's just that managing diabetes constantly can be quite overwhelming. On top of this, my vitamin D levels came back low again, didn't they?
That's correct. Your vitamin D levels are still below the optimal range, which is why I've prescribed a weekly vitamin D supplement. It's crucial, especially given the role vitamin D plays in overall health and bone strength. We'll recheck your levels again in 3 months to see if they've improved with the supplementation.
I've been trying to quit smoking too, but it's been tough. And I noticed that my breathing hasn't been great lately, especially at night. I know I haven't been using the CPAP machine as prescribed for my sleep apnea. I'm just finding it uncomfortable.
It's very important that you use the CPAP machine every night. It can significantly help alleviate your symptoms of breathlessness and improve your overall respiratory and cardiovascular health. Coupled with efforts to quit smoking, it would likely lead to noticeable improvements in your breathing.
Right. I'll make more of an effort. Speaking of symptoms, there's another thing bothering me. I've had this swelling in my right leg for over a week now. It's quite uncomfortable, and I think it's making my hip issue worse. You remember we discussed that my hip might need replacement?
Yes, I recall our discussions about your hip. The swelling could be exacerbating the discomfort associated with your hip problems. While there's no sign of acute injury or infection from your reports, it's something we should keep an eye on. I'll include this in my notes, and we can plan accordingly based on how it evolves.
I hope it doesn't come to needing surgery. Anyway, I also need to refill my prescriptions for insulin, syringes, testing strips, and Cialis. Can we arrange to have those mailed to me? I'd prefer not to come in too often, given my schedule and the discomfort.
Certainly, we can arrange for your medications to be mailed to you, along with the new vitamin D supplements. We will ensure you have enough supplies until your next appointment.
About my next appointments, I'll be out of town for a while, so I'd like to not schedule anything until after May, if that's okay.
That should be fine. We'll plan for a follow-up in June then. Please keep a close eye on your blood sugar levels and try to implement the changes we discussed. We need to monitor how the increased insulin dosage affects your glucose levels and see how you progress with the CPAP machine and smoking cessation.
Will do, Doctor. I appreciate the guidance.
Let's summarize today's assessment and the plan going forward. Your blood pressure is stable at 128/78 mmHg and your weight is consistent. The lab tests indicate stable renal function and your liver enzymes are within normal limits. However, your total cholesterol is a bit high at 202 mg/dL, with your LDL at 130 mg/dL, which we should monitor.
Got it? Anything else?
As for the plan, you'll focus on lifestyle modifications, including quitting smoking and using your CPAP machine regularly. We'll have all your medications and supplements mailed to you, and we'll follow up in June unless you experience any significant issues before then.
Thank you for laying it all out, Doctor. I'll follow the plan and keep you updated on my progress.
Thank you for coming in today. Take care and don't hesitate to contact the clinic if you have any immediate concerns or questions.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been considering some changes due to my wife's recent retirement. We're losing her prescription coverage, which is a big concern for us since I'm on multiple medications like Diovan for my blood pressure and Lipitor for cholesterol.
I understand. That must be concerning for you. Tell me more about how you've been managing your health recently and any specific issues you might be facing with your current medications.
Well, overall, I think I've been managing okay, but it's getting more challenging to coordinate everything. I take vitamin C daily, and occasionally I need cyclobenzaprine for muscle spasms. I've also been using timolol eye drops for my glaucoma. My father had heart issues, and my mother had diabetes, so I try to stay on top of my health to avoid major problems.
It sounds like you're proactive about your health, which is great. Have there been any recent changes or challenges with your medications or health in general?
Not particularly with my health, but the logistics of getting my medications without coverage might become an issue. I've also been sleeping with multiple pillows because of some back discomfort, which hasn't been ideal.
Sleeping with multiple pillows can sometimes indicate underlying issues like respiratory problems, but it can also be due to back pain. Have you noticed any other symptoms like shortness of breath or changes in your mobility?
No, I haven't had any respiratory problems, thankfully. My mobility is fine too. I can walk without assistance, though I feel a bit of stiffness, likely from aging. My main worry is about how to continue my treatments affordably and efficiently with the healthcare changes coming up.
I see. Ensuring you have affordable access to your medications is crucial. We'll look into options available through the VA. Have you had any consultations with other specialists recently, maybe for your glaucoma?
Yes, I saw my ophthalmologist last month. My intraocular pressures are stable, and there hasn't been any progression in my glaucoma, which is a relief. They did emphasize the importance of continuing with the timolol drops.
That's good to hear. Keeping your glaucoma stable is important. Let's make sure that any transfer of care includes a smooth continuation of your eye treatments. What about vaccinations? Have you kept up with those?
I got my flu shot last fall, but it's been over a decade since my last tetanus shot, and I've never had the pneumovax shot. Should I be considering these soon?
Yes, updating your tetanus shot and considering the pneumovax, especially given your age and medical history, would be advisable. We'll plan for those. Let's also ensure that all your lab results and prescriptions are updated and coordinated under one provider.
That would be very helpful. I want to avoid any interruptions or duplications in my treatments. Also, how often should I be seeing you or any other specialists to keep everything in check?
We should plan for regular checkups every 6 months, considering your conditions. If we transition your care to the VA, I'll help coordinate with them to ensure they have all your medical records and current treatment plans.
Thank you, Doctor. I appreciate your help in coordinating these changes. It's been a bit stressful thinking about all this.
Absolutely. I understand how overwhelming this can be. Let's summarize the main points of our plan today to make sure everything is clear. First, we'll initiate the transfer of your care to the VA and ensure they have a comprehensive record of your medical history and current medications. We'll also coordinate for you to continue receiving your prescriptions affordably. Secondly, we'll update your vaccinations. Finally, I'll arrange for routine monitoring of your conditions and set up the next appointments for regular follow-ups. Does that cover all your concerns?
Yes, that sounds thorough. Thanks again for helping me through this transition.
You're welcome. It's important to me that you feel supported and that your health is managed consistently. We'll review everything again during your next visit, and please reach out if you have any questions before then.